My name is Dr. Craig Malk. I'm an anesthesiologist and interventional pain management physician. I believe in a patient-focused approach to managing patients' pain. Pain is a very subjective finding. Building a rapport with our patients is of the utmost importance. We put faith in each other, we put trust in each other. We've seen the evolution of patients with acute pain all the way to a chronic pain condition. We take age, we take their background, we take their history, we take multiple factors into play when presenting them with a treatment plan. The biggest thrill is when I have a patient walk into my office and tell me that their pain is significantly better, that their function is restored, that they have returned to playing golf or pickleball or anything that has restored function to their daily life. That's the most gratifying moment. The teamwork approach is something that drew me to Illinois Bone and Joint. There's a lot of trust built with the physicians. The efficiency is certainly superior at an organization like Illinois Bone and Joint.